The Accelerate Data Viewer is part of the Concord Accelerate family of products. The intention of the Accelerate family of products is to bring bolt-on applications, accelerators, and templates to aid in the speed to market for implementing Optum capabilities. The viewer is a bolt-on to the Optum data archiving and data retirement applications. It enables organizations who have been retiring their applications and have archived all data into the Optum repository to have a flexible, easy to use, easy to configure viewer that sits on top of Optum and allows end users to access data archived into the repository. We'll begin with an example of the EMR invoicing applications as well as a document search feature. End users select the application from a portal. In this case, they would select the EMR application. There is a series of search identifiers configurable based upon the actual application that can be used individually, together, or all together to find a specific, in the example of the EMR, a specific patient, a range of patients, a range of applications, or a range of clinics and hospitals. So we can select a patient from a specific hospital, all patients from any one of 3 hospitals, patients from whose records reside in a retired application, or all patients across all applications. So a patient whose records appear in a patient Entergy or a patient billing or a patient centricity or other type application, we are able to pull the full electronic health record from the Optum repository based upon the records that have been archived. By entering our parameters, we can search, and by searching through the records within the repository, we have a results screen from which we're able to select an individual patient whose record we wish to look at. In this case, we have Richard Johnson down to Pat Jones, all records from the single EMR system, their MRN numbers, city and state, and by selecting a record, we cause the view of a series of tabs containing specific information from the archived data. We can compress our screens as well and able to demonstrate or display more information on the screen. In this case, we have configured the viewer to be an EMR viewer. It has multiple tabs containing information from the selected patient and event. The demographic tab, the pharmacy tab, were there any records, would show any pharmacy records or pharmacy history associated with the specific patient event. We can also show immunizations, vitals specific to that patient event, the full vitals from the date and time of that patient event, any labs that were ordered, any doctor's orders, office visit information, for instance, comment notes, and any attachments. Attachments could be everything from x-rays to doctor's orders to other patient records that have been scanned and added to the patient record. In this way, we're able to combine both structured and unstructured data in a single repository as a complete record for the patient history. For those clinical applications where there is a need to print out an immunization report, we also have the capability to print the immunization report for those students still attending schools. We can print records as a print all or as a default, and by selecting the print option, the print records appear in a single record that includes all of the information in the database for that patient event. Where you'd select print all, we would be printing all of the records selected for a specific patient. In this way, the EMR viewer used in this fashion allows those hospitals, clinics, medical providers who have moved on to other go-forward systems to have a complete historical record from all of the data that has been archived into the Optum repository. The data itself is saved either on the hard drive or may be printed using the Windows print function associated with the user's desktop. The application itself is developed using standard browser protocols such as ASP, .NET, and there is an end-user configurable platform behind the view that allows different organizations to take on the work of configuring the application the way that they choose based upon their internal standards or the source of data. For instance, in a hospital, even though the majority of the applications being retired would be clinical, medical applications, we would also expect to have to archive human resources applications and financial applications, which may have their own separate set of viewer tabs. Here's an example of an invoicing application where a company, in this case a construction company, has retired one of their older invoicing applications. It is the same viewing metaphor where we enter search criteria, display matching records. By selecting a record, we're now looking at the detailed tabs specific to that record. So although we come with a pre-developed EMR standard, the application can easily be configured to match the type of data within the source application being retired. One other feature of the viewer is we have a document search capability. One of the things Concord believes to be important in the retirement of applications is maintaining chain of custody and being able to demonstrate, retain a legal record and demonstrate the ownership of that legal data from the time from the source application into the retirement repository, and be able to furnish any documentation that may be in existence, documenting the original application and the work that was done to archive the application. With our document search capability, we archive within the repository the documentation used to manage the project as a historical record. So the data, the viewer, and the data documentation around the retirement project itself are all found in a single repository accessible by an end user based upon security. We have multiple levels of security within the application that an end user can that can be applied against end users, and the security itself will also allow masking of key fields. For instance, an administrator sees everything, but we may restrict a clerk to only seeing certain tabs and only seeing certain information, masking the date of birth or social security number or home phone number, whatever the end client desires. The Accelerate Data Viewer, part of the Concord family of Accelerate products.